Hi, everybody. This is Rick Bailey, president at Northern New Mexico College. Today is Thursday, July 22nd. Thank you, as always, for tuning in to our latest video update for our college community. There's a lot of change going on, and we as a college, we as a community need to be responsive to that change. We are operating in a highly complex and highly dynamic environment. As a lot of you know, we came back to campus in some capacity last Monday, July the 12th. I do want to say a special thank you to everyone, our staff, our chairs. Everyone has been really thoughtful about wearing masks when appropriate, following the guidance to the letter. More and more of you are starting to share your vaccination proof with Kendall Berrien, our health and safety officer. Thank you for doing that. If you haven't done so, please do so. Just send a picture of your CDC card to Kendall. The special email address is healthandsafety@nnmc.edu. Just send him that photo. He will add you to the roster. Again, the roster doesn't get published. That is just for him, but it gives us as a college an idea of how many people have been vaccinated, what percentage we have. The other is that the Delta variant continues to, unfortunately, to spread. It's really wreaking havoc with people in our community who are unvaccinated. That's where we're seeing the most severe cases. And there are a few, it's not rampant, but there are some cases of people who have been fully vaccinated who are also catching the Delta variant. Now, I'm not an epidemiologist, but I do know that when you are fully vaccinated, you are far less likely to get seriously ill. You're far less likely to get hospitalized. You're almost guaranteed that you're not going to suffer something seriously catastrophic. And we're also far less likely to shed the virus, meaning that we're far less likely to pass it on to others, which is why the CDC says if you're fully vaccinated, even if you come into contact with someone who tests positive, you don't need to quarantine because likely you aren't going to shed it to anyone else. However, if there's one thing we've done from the beginning, it is that we have been very thoughtful about health and safety. We've been very aggressive in how we have attacked this, and so far it has paid dividends for us, even though it's been a challenge. So I had a huge plan for how we were going to move forward. We were going to have different posters in different offices that allowed some discretion for masks and no masks. But I will tell you that just being on campus now for a week and a half, there is an anxiety here with everyone about needing a little more clear guidance on exactly how we're going to operate on both of our campuses. So this is just for now, but because obviously the situation's evolving, but I wanted you to hear this from me. Starting today, on either campus, what I am asking all of us to do is to wear masks anytime you are on either campus, with 3 exceptions. Exception 1 is if you are outdoors and you're properly socially distant according to CDC guidelines. Right now that says 3 feet. 2 is if you are in your own office or in some enclosed space by yourself with a door closed. And 3 is a little bit more complicated, but that is if you are inside in a closed space, but you are with a person or a few people where you absolutely know that everyone else has been fully vaccinated and you are all comfortable removing your masks. That will be option number 3. Perfect example, I know Amy is fully vaccinated. She knows I am fully vaccinated. If she comes in here and we have a discussion, we've already discussed with each other that we are okay with each other without our masks on. So that is exception number 3. In every other case, every public place, every hallway, we are going right now to err to the conservative and wear masks out of respect for everyone else and really to keep everyone safe. I hope everyone is okay with that. I hope everyone can live with that. But that's what we're going to do for now. As the situation evolves, as more and more people get vaccinated, as hopefully the case numbers reverse and start to go down, then we can then talk about taking incremental steps to more normal operations. But that's what we're going to do starting today. If you have any questions, any feedback, I'd love to hear your thoughts on this. Please send me an email, call us, let us know how you're thinking. But this is the way we're going to handle it, at least for the short term, for the foreseeable future. If you have not been vaccinated, if you know people who have not been vaccinated, please consider getting the vaccination. It's free, it's readily accessible, and the science is telling us that it will dramatically reduce the risks for you and the people around you, including the people at the college. Okay, that's it. I know it's a really strong message this week, but I hope it falls where it should, and I hope that you take it to heart. Again, please send us your feedback. And thank you for everything you're doing, and thank you for being with us on this journey. From all of us at the college, our students, our faculty, our staff, we say muchísimas gracias. Kunda woha. God bless you and everyone you love. Thanks very much, everyone. We'll talk to you soon.